Okay, so we have the ASD mainstream protocol versus functional health. Starting at the ASD diagnosis, it gets interesting from the very beginning. Um, that diagnosis begins with an observation from a developmental pediatrician or a neurologist or a psychologist. So the criteria for the diagnosis is set forth by the American Psychological Association. Hence, a psychologist can be one of the observers of the process. So they're going to sit the patient down, they're going to observe with this checklist of behaviors, and if these behaviors, enough boxes are checked on those behaviors, then a diagnosis is set. Then they go from that to the severity of those behaviors. So there's the level 1, 2, and 3, and severity 3 being the worst. Now you have an ASD diagnosis and the severity of which. Now, at this point in the process, a lot of people think this is a neurological diagnosis. It's talked about that way a lot of the times, but it's a psychological diagnosis. The standard diagnostic criteria is set forth in the DSM-5. After your diagnosis, the mainstream protocol begins. There's one protocol. The first is ABA, which is behavioral therapy. All of those boxes that were checked on the diagnosis, those are behaviors. That's why the mainstream protocol discusses it in terms of behaviors. They only think of autism as behavioral. It's a psychological disorder in their mind. So what's going to happen at behavior therapy? Mimic. It's going to be social mimicking, teaching how to respond in situations, trying to lessen the behaviors that are listed on that diagnostic criteria. After ABA, next is psychological medication. You're looking at clonidine, Wellbutrin, guanfacine. These are, and many like it. So behavioral therapy, psychological medication, this is the ASD mainstream protocol. There's no way around it. Everyone that's come through our practice with an ASD diagnosis and colleagues' practices have physiological coexisting conditions that exist. Here's the frustrating part. Bringing those things up to your pediatrician at the ER when it gets severe, trying to find specialists to treat these things. All of these physiological coexisting conditions get swept under the rug of autism. Oh, that's just autism. Can't count how many times we've heard, oh, the doctor told me, yeah, that's just autism. Get used to it. The practitioner at our practice with their own child, that's exactly what happened. That's actually when the light bulb went off, is there's got to be something else to do. Now, functional health, through all the myths, through all the legends, there's no charms, there's no crystals, there's no hippie zombies. Functional health is actually a testing-based, fact-based, systematic, natural process to address, simply was created to address the physiological symptoms that are being ignored. So, what happens? Functional health starts testing, starts finding out the root causes of those issues. Where are these issues coming from? What's causing these issues? A lot of it is dealt with the immune system, the largest part of the body's immune system, which is in the gut. These coexisting conditions range from person to person. There's no one size fits all. You see a range of things from low muscle tone, slow growth, sleep issues, GI tract issues, heightened allergies, constipation, diarrhea, and more. But all those, again, all of those physiological symptoms are just swept under the rug of your psychological diagnosis. All of a sudden, nothing can be done about these things. Functional health starts testing. We start finding the root of these things. We start getting to the bottom of what's causing these things. There's a myriad of tests we do. Did a video about testing. You should check that out. And we go into all the different tests. After all of this testing, that's where your treatment plan comes in. With functional health, this is a natural process. So it's foods, dietary changes. That's why these videos are all done in the kitchen. This is where a lot of the work is done. Changing what goes into the body and finding out what the body is needing in that immune system to offset the coexisting conditions and support the body in changing. So you have a treatment with that diet plan and supplementation on top of that. Testing along the way as well to see how the body's responding, what needs to be done next. and progress happens. Now, when a proper functional health testing-based process is followed in our practice and in colleagues' practices, we're seeing virtually every client benefiting from this. I'm talking approximately 95% of clients. These clients are finding relief across the board on their symptoms. This is where things get wild. I am not entering the fray of cause or cure. This is where a lot of grandiose claims get made. But the fact of what happens when you deal with those physiological coexisting conditions that got swept under the rug in the psychological treatment of the mainstream protocol, when you deal with those physiological issues, everything else starts to get better. In the best cases, we've seen the boxes that got checked on your ASD diagnosis get unchecked. We've seen that diagnosis reversed. That's where some people get crazy and say, oh, we've cured it. That's not our claim. What our claim is, when you follow this, everything seems to improve. Why the choice to be swept under the rug exists is the maddening part, where people get angry and frustrated, and understandably so. It doesn't make a whole lot of sense. But that is where the mainstream protocol exists. This is what functional health does and what it focuses on, and these are the results that we're seeing in our practice, in our colleagues' practices, and in our own children. But what's really important, and I want parents out there who are going through that ASD diagnostic process to understand, is that there are other options. And they are science-based options, they are testing-based options, they are evidence and results-based options. You don't have to rely on a two-step psychological mainstream protocol. There's more out there that's gonna address those coexisting conditions that you're also seeing. When you're told that there's nothing else that can be done, there is. So there's a lot in this world, and there's a lot to understand. Reach out to us anytime. Send us questions. Let us know what you want to know.